Every day, hundreds of people walk through the doors of Winnipeg's biggest and busiest emergency room in Manitoba, but they're often left waiting hours for care.
Long waits aren't an inconvenience. They are a danger, a clear and present danger to patients.
And that danger can escalate when frustrated patients end up walking out of the hospital without seeing a doctor.
What's thought to be a minor headache can be a stroke or a bleed into one's head. The whole point of seeking care for a new symptom is to have experts in the field look at you.
But too often right now, that's not happening. According to Shared Health, recently 34% of patients, or 1 in every 3 people at HSC Emergency, walked out the doors without receiving care, nearly triple the amount from 2019.
This is unprecedented. I actually never dreamed it would be this high. It's a nightmare.
It's a problem impacting every hospital in the city. At St. Boniface, it's happening 2.5 times more often than in 2019. And at the Grace, nearly 4 times.
If anybody was waiting for the apocalypse to actually make changes, let them know it's here.
Dr. Alex Chochinov says ideally less than 2% of patients leave. And once that rate goes above 10%, there are going to be deadly outcomes.
High left without being seen rates result in increased morbidity and mortality. So numbers at 20% or 30%, as you say, they're a recipe for disaster, and those disasters are happening right now.
How often patients leave a hospital without seeing a doctor is a rate tracked closely by health officials. It measures how the emergency department and the healthcare system is functioning. And right now,
we're struggling being able to get people the timely care that they need.
HSC Chief Operating Officer Dr. Sean Young says the system is overwhelmed and staffing continues to be a critical issue.
It's terrible, and it's distressing for patients. It's distressing for our staff. It's a place none of us want to be. None of us wanted to be in, even this far along the road.
Patient flow is being stifled at every access point. Beds on units are full, and because of staffing issues elsewhere, patients are unable to be moved to long-term care, home care, or hospitals in other communities.
So some pieces of this will be quicker to solve, but at the crux of this is the entire ladder of our healthcare system is facing the worst staffing crisis it's ever faced.
Young says while they are aggressively recruiting, this is a problem being felt across the country and around the world, and it's going to take time to fix. Brittany Greenslade, CBC News, Winnipeg.